is, dinging the gavel. Welcome to the April 13th. It's a New World meeting of the Utilities Commission. 47, Chris Park.
In April.
So I've started the recording now, and we will
It looked a little bit soft. Okay, so the microphone is working on mine over here. It's showing over here. Are you on the station? Are you on the station now, Bell? Hey, boss. Good morning. Your mute's on. Hey,
Morning.
you off to a good start today?
Yeah,
I should have
good
known
start.
we'd wake up to change it.
That's right.
That's all right. That's the only thing constant, right?
So who we got on? Have anybody out on here yet from the media?
So Tasha is on, Larry's on. We don't have any media yet. Expecting a full house, it looks like. So uh, we'll see. It's going to stream live on Facebook, and then we're doing a test to see if it can stream off to the it's streaming live on YouTube, and then we're testing to see if we can get it to go over to Facebook at the end.
Okay.
We'll see. Hey, there's Mr. Duquesne. Mr. Duquesne.
No. The Queen.
Duqueenie. That's right. Mr. Queen.
Good morning.
Good morning. Hey, Lee, you read that article I sent you?
Yeah. Yeah.
That's interesting. I mean, that's China, though. I mean, they
All right. Whatever. Good morning. I'm Alan Joins, Mayor of the City of Winston-Salem, and we're here this morning to bring you an update on the status of the pandemic affecting here in Forsyth County. We have with us this morning Joshua Swift, who is the Director of Forsyth County Health Department. We have Damon Duquesne, who is the Assistant City Manager, who can comment about the city's preparedness and the city's actions that we've had to take relative to essential services. We have the City Manager, Lee Garrity, on the call. We have Assistant City Manager Tasha Logan Ford, who will be able to speak to the situation with regards to the homeless here, as well as August Vernon, who is the Director of the City County Emergency Management Department. As you know, on March the 27th, I put in place a stay-at-home order along with other restrictions that expires this coming Thursday on April 16th. First of all, I'd like to thank our community, our city, our citizens, and businesses for the good job that you have done in adhering to that stay-at-home order, as well as the social distancing efforts that we've done. Now, I know it's been very difficult for our citizens because we've not been able to visit with our family, with our friends, to go out and do things that make our lives enjoyable. But it was very crucial that we took that action when we did. It was important for our citizens and important for our health. I received the endorsement and the encouragement by both of our large medical centers here to take that action so that we could flatten the curve, so as not to overwhelm our medical systems as we start hitting the peak of this pandemic. It does appear that our actions are making a difference, even though the number of cases are still rising. Since March the 8th, we've had 119 cases here in Forsyth County, and 46 of those cases are still active. Of course, Swift will give more detail on that in just a moment. And unfortunately, there have been 4 deaths here in Forsyth County. Recently, a group of experts from Duke University, from UNC Chapel Hill, have made some projections relative to this pandemic. One of those projections assumed that we began lifting the restrictions at the end of April. If that were to happen, in their opinion, we could have a 50% chance that we would overwhelm the medical systems here in the state and in Forsyth County. However, if the restrictions were kept in place to the end of May, that chance of overwhelming the systems dropped to 20%. So therefore, based on that data, based on consultations with the heads of our 2 local medical centers and consulting with the City Council, I am today signing an order that will keep in place our emergency declaration, including the stay-at-home order, for 3 additional weeks until May the 7th. At that time, we will evaluate our current situation and take additional steps as necessary. Of course, optimistically, if things improve, we can always rescind that order or rescind portions of that order. I hope we can do it quicker, but the projections that we're seeing don't indicate that that will happen. It is possible, as the governor started talking this weekend, about some type of a rolling restriction lifting. Now, my amended order keeps in place all the definitions as contained in the original order and also incorporates the actions taken last week by Governor Cooper to add some additional requirements for retailers that remain open. Now, I want you to know that I did not take this action lightly. It is one that is difficult for our citizens, as I mentioned. I've consulted with the medical professionals, with others, with the City Council, but again, we believe that these strong actions taken now will allow us to manage the crises and hopefully get to the end of the crises much sooner than if we did not take the actions. That's always been my goal, to balance the public safety and health of our citizens with the need to preserve and maintain as many jobs as practical. Now, some of you may think the worst is over and that we can start lifting our controls, but I believe that's a dangerous path for us to follow, and one that could result in many more deaths occurring, and also delaying a return to normalcy. So I asked our citizens to just hang in there with us for another 3 weeks. Let's be smart about this, and we can get folks back to work. Now I'd like to ask Joshua Swift, our Director of Forsyth County Health Department, to give us an update on where we're at right now. Mr. Swift?
All right. Thank you, Mayor. As you've already stated, we have, as of yesterday, 119 confirmed cases in Forsyth County, with 73 of those cases having been resolved, and unfortunately, the 4 deaths. I'd like to reiterate that the best way to prevent the spread of COVID-19 at this time is for individuals to stay home. And I want to take this opportunity to thank the Department of Public Health, our staff, and the many partners, city, county, and the hospitals, the school systems, colleges, and universities that we're working with on this to respond to this pandemic. As of April 12th, our latest statistics show that 45% of Forsyth County cases are in persons under 45 years of age. And that gives us concern because young adults may have few symptoms or no symptoms, but spread COVID-19 to those at highest risk. 32% of our individuals are between 45 and 64, and 23% are 65 and over. Our rate of cases is lower right now than the state rate, but higher than our neighbors in Guilford. And we're releasing that information on a weekly basis. I guess the only other things I would say right now is we believe there are undiagnosed cases of COVID-19 since we have community transmission. People may be transmitting the virus to others without knowing it, which makes it even more important that we follow the stay-at-home order. We believe they're making a difference, as you said, Mayor, because COVID-19 is highly contagious. People who are infected can have the virus for days before showing symptoms, and some will never have symptoms. So you could feel fine, but be bringing COVID-19 into your home and to your loved ones. So stay at home and practice social distancing. And that's it for my update. Thank you.
Thank you, Director Swift. Thank you for the hard work that you have done and all the members of your department have done. As you know, because of the city's contribution of $1 million and many other generous contributions by our community, we've been able to raise $3.3 million for what we've called the COVID-19 Forsyth Recovery Fund, Response Fund. I'm grateful to all of those of you who have contributed. Many individuals did, many companies, many corporations did, and already 15 grants have been made totaling over $1 million to agencies and programs that are designed to help get assistance to many of our citizens who are suffering because of the negative impact of this pandemic. I would just remind folks that if you are a nonprofit and want to apply for one of these grants, you can go to the COVID-19 Forsyth ResponseFund.org and find ways to make that application. If you're an individual who needs help, you can go to the 211 system and find out which agencies are providing assistance to you. We've also been fortunate that we're starting to get some assistance from the federal government to help us with this crisis. For instance, we got an additional $1.3 million for our Community Development Block Grant, a program that will help us in a number of ways, as well as $660,000 that will help us deal with homeless population in a temporary situation. And then also FEMA, the Federal Emergency Management Authority, recently approved the use of hotels, motels, and dormitories for temporary housing for our homeless population, or for individuals who don't have stable housing opportunities. And we here in Forsyth County have used that a little bit already. I'd like to ask our Assistant City Manager, Tasha Logan Ford, to give us a very brief update on the very comprehensive four-pronged approach that we're doing here in Forsyth County to deal with the homeless situation. Ms. Ford?
Thank you, Mayor. Hello, everyone. We are working very closely with our community partners through the continuum of care to provide support for individuals that are experiencing homelessness during this pandemic. We have organized our efforts into 4 different categories. First, focusing on individuals that are COVID positive or are showing symptoms of COVID-19. Our county partners have taken the lead on this effort and are providing non-congregate housing to individuals that are either symptomatic or are awaiting tests. So we are making sure that those individuals are not housed in our shelter situations. The next group that we're focused on are individuals that are medically fragile. These are individuals that may have underlying health conditions, and there are specific guidelines that are provided by the CDC. We are working to also have those individuals that are housed in individual settings as much as possible, and are working towards getting that plan up and running with our partners. Our community partners through the continuum of care who are working with us are also out doing street outreach with individuals that may be in camping situations. And we have also had a coordinated response with law enforcement so that if we identify individuals that are camping, we are not ticketing those individuals. We are trying to identify locations for them to be moved to in partnership with our continuum of care service providers. At any given time in Forsyth County, we have anywhere between 450 individuals that are in some stage of homelessness. This may be individuals that are camping or in our shelter system. We have beds that are available, but we also realize that we want to maintain social distancing in our shelters. Public health has been providing advice and support in those mesh shelter situations, so that has on some level limited the number of individuals that we're able to house in those situations. But between looking at options to make sure those that are medically fragile have an option, which is in progress right now, making sure that individuals that are COVID-19 positive or have symptoms and are waiting testing, while isolating those individuals out of the general shelter population, we're starting to see and have some options available for people in the community.
Thank you, Ms. Ford. I'm sure there'll be maybe some questions at the end of the news conference here.
Sure.
In that regard, also, the city received $12 million from the Federal Transit Authority recently, and the city will use some of those dollars to allow us to begin a free transit service beginning tomorrow. That's April the 15th. And the reason we're doing that is so that our drivers do not have to interact directly with passengers getting on board, exchanging money, exchanging tickets, and things of that nature. Also, we'll be designating each other alternate seats on our buses so that we can help provide social distancing on our buses as well. So again, there'll be free transit starting tomorrow, April 15th. I will say that we're also working on a number of other initiatives that hopefully we'll be announcing later this week or early next week that I believe will potentially position Winston-Salem as a leader across the nation and really in dealing with this pandemic, and hopefully we'll do even more to help us to get to the end of it and get our folks back to working as quickly as possible. Thank you for joining us. We'll now be glad to take a few questions. And again, if you would please tell me what organization you're represented and what your question is.
Mayor Jones, this is Wes Young at the Winston-Salem Journal. Can you hear me okay?
Yes, Wes, got you here.
Okay, just wanted to make sure this is working because sometimes when I get it going. Anyway, we've heard from small business owners who are concerned that they're not getting the help they need. You know, we've got programs out there to help people suffering from economic impacts. What are we doing for small businesses in Winston-Salem, and do we need to do more?
Thank you, Wes. I certainly agree with that. There's been a certain level of frustration, particularly on the SBA kind of disaster fund that are there. I will say that our Greater Winston-Salem Inc., our Chamber of Commerce, is putting together a very aggressive plan that will provide some assistance to small businesses and help them understand this. We are also looking here within the city about ways that we can help kickstart the economy going forward with helping our small businesses. We haven't gotten those plans put in place, but Evan Raleigh, our assistant city manager, is doing some work on that as well. But we certainly hear what the small businesses are saying, and I believe between what the chamber is doing and what we will do, we'll be able to help these companies get back going when we open up these restrictions. Other questions?
Hi, this is Talitha Vickers with WXII 12 News. This question is for Mr. Swift. Is he able to answer any questions?
Yes, you can.
Yes, I'm here.
Oh. Hi, Mr. Swift. This is Talitha Vickers with WXII 12 News. It cut out a little bit when you were giving us some of the numbers. could you just reiterate? I think you said 40% of the cases were among what demographic or population?
Yes. So 45% of the cases in Forsyth County are persons under 45 years of age. And the concern there is that young adults, they have few or no symptoms and spread COVID-19 to those at highest risk, either in their family or just people they come in contact with. 32% of cases are in individuals between 45 and 64. And then 23% of cases are 65 and over. So those are our numbers, and we have.
Okay, and in that same vein, Mr. Swift,
Yes.
I'm sorry, go ahead.
No, I didn't. You're asking a question. I didn't hear it.
Yes, I was saying, just in that same vein, are you able to speak to medical supplies and where we stand right now with PPEs, or if the mayor can join in with that, in terms of medical supplies, not only for our local hospitals and medical teams, but for those who are within the city on the front lines, buses, sanitation. Do we have enough supplies?
We are working with emergency management to request those supplies, and August Vernon is also on the call. I don't know if he is available.
Yeah, August, maybe you could comment on that, please. August Vernon, our Director of Emergency Management Services.
Yeah, certainly. Can you hear me?
Yes.
All right. So good question on the personal protective equipment and other medical supplies. Actually, last night we actually received our first very small shipment of some very limited supplies. Obviously, the answer number one is PPE is a challenge nationwide, and our normal process that we get those resources from the state, our federal assets, we're unable to accomplish that. So we're looking at just trying to get it from private market and other venues. So the PPE issue is still a big challenge for our community. We do have agencies that are using the homemade masks if they have to. We're continuing to put in those requests and continuing to search and scour for all the PPE and other medical supplies that we can, but it is still a big challenge.
Could you
August.
just let us know in terms of, I know you said a small supply was given. Are you able to disclose like how many we received?
I don't have those exact numbers, but we, as a county, we put in over 200 requests for PPE. And what happens is they will try to give us small percentages of some of those requests. So it's not any one organization got a lot of supplies. It's pretty diverse and spread out. I don't have the exact numbers in front of me. We've got a different team that's working on that. And we've been told to expect more supplies in the next few weeks.
Thank you, August. Did I get your questions, Ms. Vickers? Any other questions?
I have a question. David Ford with WFTD Radio.
Yes.
A question for August. I'm wondering what kind of impact have the local suppliers had? Some of the local manufacturers that are retooled to provide hand sanitizers and gowns and stuff like that. Any implications there? How much of an impact has it been? Excuse me.
Yeah, so the first way I want to answer that is we're very fortunate. 3 weeks ago, we stood up a working group with our local Chamber of Commerce, and they've got a team that are now working with our local business and industry to transition that over to trying to produce PPE, medical supplies, and other hand sanitizers. They've had some limited success, but it does take some time to make that transition. Obviously, any local supplies we can get, and I know some of that is taking place, we obviously are going to try to get those supplies locally anytime we can. But also, one of the reasons the working group started for that was we also saw that as a way to help with local employment, to keep these local businesses engaged and working as much as possible.
Thank you, August. David, thank you. And again, hopefully by the end of the week, early next week, we'll maybe have some additional announcement regarding some local manufacturers that are really stepping up for our community.
I have one follow-up question for you, Mayor Jones, if I may.
Yes.
I've been here since 2002, an explosion in local businesses, restaurants, et cetera. And I'm wanting to know, you give me a sense of what you're hearing from local business owners, the impact of this long-term in terms of maybe a best case or worst case scenario. How are they feeling? How do you project they're going to do coming at the tail end of this epidemic?
Are you speaking specifically about restaurants, David?
I could expand that to, yeah, well, let's just expand it to so many small businesses in the area have grown since over the last 20 years. I mean, it's been a steady growth. And
Yeah.
what are you seeing today?
No, absolutely. The growth of small businesses in our community has really been the majority fueler of our new jobs that have been created here. I'm hearing, and probably as much as everyone has, the very negative impact on a lot of these small businesses, particularly the restaurants, some of which are very small operations who live, kind of week to week to make sure things happen. So that's one thing we got to look at and maybe make sure we can help these folks get cranked back up when we do lift these restrictions and they can start operating once again. I think in general, the quicker we can get through this and get the businesses back open, and it'll take a while. It's not going to be like turning a switch on and one day it's here and one day it's not. It's going to be a gradual ramp up. And so we're going to ask our citizens to work with us on that regard. But as always, we're asking our citizens to support our local businesses as much as possible. Many of the restaurants have takeout services now, and I've been using them just about every night. I think seeing some traction in that, but it's that so many people have been laid off in that industry, and that was one of the reasons I worked so hard to help create this response fund, was to help those in the hospitality industry and service industry who have been laid off.
Thank you.
Other questions?
I've got a question for
Yes.
Mr. Swift.
This is Talitha again from WXI
okay,
12
sorry.
News. This question is for Mr. Swift.
Go ahead, Ms. Vickers.
Yes.
Mr. Swift, outside of the thank you. Outside of the Thursday weekly briefings, will there be any other availability when we do have urgent cases, like, for example, the initial unfortunate death of the first case of COVID, related to the first case of COVID-19? Will there, outside of that Thursday briefing, be any updates from your office?
Well, at this time, we are working with the county manager's office. We do the daily briefing that goes out at 11:30 a.m. We're doing that 7 days a week, and obviously doing the Thursday media conference call now, Thursdays at 4 p.m. If we see a need where we need to have more regular events, or we need to have, if something unforeseen happens, we'll definitely have that option available to increase the frequency or do special briefings if needed.
Thank you, Joshua. Wesley, you had a question, I believe. Wes Young. Anybody else have a question going forward? Just would reiterate that what we're doing today, among other things, is to extend our stay-at-home order and emergency declaration to next 3 weeks, to May the 7th. And obviously, I know Director Swift would probably comment on this, that one of the things that would be very important is our ability to do more widespread testing here in our community that will give us a better feel for what's really going on there. Unfortunately, right at the moment, we don't have those test kits available. There are a number of new, models being worked on, but until we have those, it would be more difficult to do the widespread testing that would be helpful.
I had a question. Can you hear me?
Yeah, Wes,
Hello?
go ahead.
Oh, okay.
Yeah.
I guess I couldn't get through before. I had a question for Joshua. It looks like the chart, if you look at the chart of daily cases, it looks like it might be cresting. Do you have any optimism that maybe we are nearing a crest, or what do you think we're looking at there?
Well, I think that's a good observation, Wes. And I believe I don't know if it's a crest. It's hard to say. There's a lot of uncertainty. We do know, I mean, this could be, some people might call it a plateau where the cases just slowly rise, but not as exponentially. I think the thing is that we have to be vigilant because we have a lot of people that are out there with community spread that either have no symptoms, so they don't get tested, or they have symptoms but are advised to stay at home so they're not in the numbers, so we can't get too overconfident. And as the mayor said too, this isn't a on-off switch where you can just get back to normal the next day. We've eased ourselves into this or went into this over a course of a few weeks, and it's going to take weeks to get back out. So we just have to rely too on what the state and at the national level guidance they're seeing and what they're seeing in other areas. But we are excited. We are glad to see that the cases have that it's not as steep as it was.
And
But
a follow up to that, if I could, is there a formula that you guys in health look at to sort of say, okay, if you've got 119 positive cases that you've diagnosed, how many undiagnosed cases are there out there for those cases? Is there a number or a formula that people use to figure that out?
Since this is new, we don't know that. I'm sure there will be lots of formulas that'll come out from the academic and scientific researchers after this, but we don't have that number. But we are certain that there are many cases out there that are undiagnosed, just because of the fact that what research has been done shows that there are some numbers are showing even up to 25% of people that have COVID-19 don't have symptoms.
Following up on that, Mr. Swift, of the 73 that have recovered, do we know how many of those were people who recovered by virtue of going to the hospital and getting treatment, or how many of those were people who recovered at home at their own?
I don't have those numbers in front of me, and but that is it was a combination. We do know that there were some that went to hospitals and recovered, and some that recovered at home.
Okay, and then for Mayor Joines,
Yes.
outside of extending, this is Talitha Vickers again from WXII, sorry. Outside of extending the stay-at-home order, are there any other restrictions that you're considering to put on the table to, keep the city safe in terms of, I know other counties and cities in the state have done a bit of an aggressive approach, or some might see as it a bit more aggressive in terms of not allowing outside people. If you don't live in the city or live in a particular county, you cannot come in, putting up roadblocks, things like that. I don't know if we're there just yet, but I'm just curious to know, are there any other restrictions outside of extending the stay-at-home order that you're considering?
At this point, we're not. I think the roadblocks and things of that nature, I think, are not something we're looking at all. I think one thing that I alluded to, we have some plans that are nearly ready to announce that I think we'd be asking more voluntary compliance with some ideas we've got for our citizens that I believe would really have a major impact on controlling this situation. But we did, as I said, incorporate it into my most recent declaration, the governor's additional restrictions last week vis-a-vis the large retailers and the spacing and the additional sanitation methods that he's requiring there. Also requiring that no more than 20% of the space could be occupied in terms of the numbers of people per 20% of space. So other than that, Vickers, we don't have any other plans at this time. Other questions?
And for sanitation, Mayor Joines, or
Mhm.
sorry, it's not sanitation, for transportation needs and allowing the free services for the bus drivers, for those employees, are fuels or sanitizing equipment being offered to them?
Absolutely. We are also, as I mentioned, we're retrofitting the buses to, I might ask Damon Duquesne, Damon, would you comment on some of the other steps we're taking there, please?
Yes, sir. Thank you, Mayor. Talitha, so we're installing the plexiglass shields to provide a barrier between the drivers and the passengers, providing cloth masks for the drivers. The route reduction, when we went initially to the Saturday service, Monday through Saturday, that allowed us to be able to sanitize each bus between trips and gave us a reserve of drivers. So all of those materials and those processes are in place. As for the fare free, we're also limiting the number of passengers, so not just separating the seats, but there's a 15 passenger maximum on each bus. As a bus reaches that capacity, the drivers will call back the dispatch to have another bus come out and continue on so that we only have 15 passengers per bus. We've also contracted for additional sanitizing and cleaning crews to make sure that we can, because we're going to have more buses in the rotation, because we do expect ridership to pick up a little bit. That's the downside of the free fare is we've seen it in every other community. So we want to make sure that we can keep the buses sanitized, people getting to where their destinations are as close to on time, and protecting our drivers as much as possible.
And when will the retrofitting occur, or has that already started?
It's done.
Okay.
Thank you, Dan.
Hey, it's Wes again from the Journal. I have a question. I guess it's for Tasha about the homeless situation. So, is the effort to enter into contracts with hotels or something to provide rooms for the homeless? How exactly is this being arranged?
Thank you,
Is
Wes.
Tasha still there?
Yes.
I am.
Okay. All right.
So thank you, Wes. So we have been engaged in conversations with a couple of different hoteliers trying to work out some specifics to be able to house those that fall in the category. But we have been able to secure a separate facility and work with any individuals that are homeless that are that have either tested positive or are showing symptoms. So we have coordinate housing situations, alternative housing situations for those individuals that are not in the general shelter sites.
Thank you, Tasha. Thank you, Wes. Ladies and gentlemen, thank you all for participating. Again, let me just emphasize, let's hang in there, be smart for at least another 3 weeks. Be even more diligent in your stay at home and your social distancing and your hand washing, and to particularly our young people. You know, you may feel a little bit not threatened by this, but as the Mr. Swift pointed out, you could get the virus and take it home to an elderly grandparent or parent and really impact it. So let's be very, very careful out there. Thank you, Winston-Salem. We'll get through this together.
Thanks, everybody.